There's one of our many success stories. On behalf of our president, Dr. Harvey Feinberg, and myself, I'd like to welcome you to this very important gathering, the Institute of Medicine. I was listening to the radio on the way in, and it was all about what happened in Boston. And this week, we're once again, as Jackie noted, as a nation, facing inconceivable acts of violence against innocent people on a massive level. But I couldn't help but think about, again, as she noted, the differences between what was going on there and what we're doing here and why we're here. And we come together today to discuss something that is just as inconceivable, just as wrenching, gut-wrenching. And we can't say that this happens on Boylston Street in Boston. It's hidden. It happens in people's homes. It's out of sight. It happens to one person at a time. And that's why I think we need to elevate this issue and bring it out into the open so there's more discussion of what we need to do. For me, this is very personal. I'm a geriatrician, and in my time at the DCVA Medical Center, I would make house calls. And I would always, when I was seeing a new patient going to their house, before I went in, I'd always take a deep breath because I never knew what was on the other side of the door. And luckily, most of the time, what I saw was, pretty good situation, caring families, people who were able to manage on their own with significant disabilities and conditions. But, every once in a while there would be that situation and you walk in and you'd feel it in your gut. Now, I know I'm supposed to be a scientist, I'm supposed to talk about evidence, but this is something that you knew at the gut level. And there, you could sense that a person wasn't being adequately cared for, that they're being taken advantage of in some way, financially, so many different kinds of ways, and or they were neglecting themselves. And the horrible situation that I would confront was made much more difficult because I would feel powerless. There I was as a physician leading the home care team in the home with resources there, but not the right resources to take care of this situation. And I remember many times doing things that would probably border on illegal, to lie about my patient's condition so that I could get them admitted in the hospital because I had no other way to get them out of a horrible situation. And it was that experience and the experience of feeling so powerless to care for and do my job as a physician to care for those patients that has made this a part of what I take with me into everywhere I go with all my jobs. And when I came to the Institute of Medicine, this was one of the areas that I said we really need to address. It's taken a long time. It's taken the efforts of many people in this room. But I'm here to tell you that I am not only so pleased and thankful for the people who made this happen, but that this, in the view of the Institute of Medicine, is the first step. That what we need to do is come together, think about strategies, approaches, and things that we can do in new and innovative ways to address this problem. It's a situation where we hope that our convening power, bringing all of you together today, can begin the dialogue, but we need to take this to the next level, and it's going to take all of us in this room to do that. So I want you to think about this as a team effort, and caring for older people, as all of you know, is a team effort. But to really address the problems among the many problems we have with aging in this country, is something that I hope that we can all really continue to be aware of, increase awareness of, and bring other people to the table to help us solve these problems. So I'm very grateful again to the planners of this, to the Violence Prevention Forum, which has done such spectacular work, and it couldn't be more timely given what's happened in our country in the past few months. And I am so pleased that we're able to kick off this meeting with Kathy Greenlee among us. Thank you, Kathy. As most of you know, Kathy Greenlee was appointed by President Obama as the Assistant Secretary for Aging at the Department of Health and Human Services in 2009. And she has additionally been appointed as the Administrator for Community Living, which is the new federal consolidation of programs bringing in the Administration on Aging, the Office of Disability, and the Administration on Developmental Disabilities together under her auspices. And I have to note that the Administration on Aging is one of the founding sponsors of our forum. And I think it speaks to her commitment and the commitment of the department to seriously address these issues. And I must also tell you that while we have a number of organizations and agencies, it's rare that we have the head of that organization agency who's so involved. But Assistant Secretary Greenlee has been that person, has been right here and has been part of this discussion from the get-go, and we are pleased for that. And she's been championing the causes that we're here to discuss today. And we're very happy that she was able to make it today and will be a part of our discussions, because she's going to be a key person in helping us carry these messages forward. Kathy, welcome.